Today we'll be presenting the shoulder joint, also known as the glenohumeral joint, by Carleah, Hartley, and Scheel.
The shoulder joint is a ball and socket joint, and it would be considered multi-axial. The shoulder joint is formed by the articulation of the head of the humerus with the glenoid cavity of the scapula. This gives rise to the alternate name for the shoulder joint, the glenohumeral joint.
Here's an example of a ball and socket joint in the shoulder.
This slide shows the anatomy of the scapula, and from the front view you can see the glenoid cavity, the coracoid process, and the acromion. And then from the back view you can see the body, the neck, the superior and inferior angles, and the spine of the scapula.
The joint capsule and why it is significant. The type of joint capsule is the fibrosus joint capsule. The fibrosus joint capsule is significant because it is the largest capsule in the body, and its function is to hold the bones together and made up of the scapula and the humerus.
The accessory structures of the shoulder joint. First is the labrum, which is a fibrocartilage lip that extends over the edge of the joint socket. It's located in the hip and shoulder joints, and it helps to deepen the socket, make stronger connections between the articulating bones.
The other one is a bursa, sac-like structure that helps to reveal friction, contains some fluid found in the shoulder and the knee joints.
And last is the tendon sheaths. They are tube-like bursae found over certain tendons to relieve friction, and they are found in the shoulder, the wrist, and the ankle.
Motions that occur at this joint. The human shoulder is the most mobile joint in the human body. This mobility provides the upper body within a tremendous range of motion. These different range are adduction, abduction, flexion, extension, internal rotation, external rotation, and 360-degree circumduction in the sagittal plane.
The definitive ligaments of the shoulder joint are the sternoclavicular joint ligament, the acromioclavicular joint ligaments, and the glenohumeral joint ligaments.
The sternoclavicle joint articulation. The sternoclavicle joint consists of the sternal end of the clavicle, the main manubrium of the sternum, and the part of the first costal cartilage. The articular surface are covered with fibrocartilage. The joint is separated into two compartments by our fibrocartilage articular disc.
The acromioclavicular joint articulation. The acromioclavicular joint is located where the lateral end of the clavicle articulates with the acromion of the scapula. The articular surfaces of the joint are lined with fibrocartilage. The joint cavity is partially divided by an articular disc, which is a wedge of fibrocartilage suspended from the upper part of the capsule.
The glenohumeral joint articulation. The shoulder joint is formed by the articulation of the head of the humerus with the glenoid cavity of the scapula. Since this is a synovial joint, the articulating surface are covered with hyaline cartilage. The head of the humerus is much larger than the glenoid fossa, giving the joint a wide range of movement at the coast of the inherent instability. To reduce the disproportion in surfaces, the glenoid fossa is deepened by a fibrocartilage rim called the glenoid labrum.
There are different roles of the sternoclavicular ligaments. The joint itself is weak because of its bony arrangement, but it is held securely by the strong ligaments that anchor the clavicle to the sternum. There are four main ligaments. The first one is the anterior sternoclavicular.
Prevents upward displacement of the clavicle.
Posterior sternoclavicular.
It also prevents upward displacement of the clavicle.
Interclavicular.
Which prevents lateral displacement of the clavicle.
And costoclavicular.
Which prevents lateral and upward displacement of the clavicle. Here is a picture of the sternoclavicle ligaments.
You can see where the sternum and the clavicle attach with the sternoclavicular joint.
The role of the acromioclavicular ligaments. It consists of anterior, posterior, superior, and inferior portions.
The coracoclavicular ligament.
It joins the coracoid process in the clavicle and helps maintain the position of the clavicle relatively to the acromen, divided further into two ligaments.
The conoid and trapezoid ligaments.
The ligaments permits movement of the scapula at the AC joint because it develops some slack.
And the coracoacromial ligament.
Connects the coracoid to the acromen and helps the coracoacromial arch.
Here's a picture of the acromioclavicular ligaments, and you can see how they connect the scapula to the clavicle as well.
Role of the glenohumeral ligaments. It is made up of the superior, middle, and inferior glenohumeral ligaments and by the tough coracohumeral ligaments. The coracohumeral ligaments tough attached to the coracoid process into the greater tuberosity of the humerus. The anterior glenohumeral ligaments tense when the shoulder is in extension, abduction, or external rotation. Posterior glenohumeral ligaments
Is greatest tension is in extension with external rotation.
The middle glenohumeral ligaments.
Is greatest tension when in flexion and external rotation.
The inferior glenohumeral ligaments.
Is most tense when the shoulder is abducted, extended, or externally rotated.
And the last one, the transverse ligaments.
It retains the long head biceps tendon with the bicipital groove by passing over it from the greater to the lesser tubercle.
And here an example of the glenohumeral ligaments, and you can see the different types of glenohumeral ligaments and where they attach.
The role of the glenoid labrum. The glenoid labrum is a cartilage ring inside the glenoid fossa. The glenoid fossa is a shallow, concave cavity that the humeral head fits into, also a landmark on the scapula. The role of the glenoid labrum deepens the fossa and helps stabilize and cushion the joints.
Structures that provide stability in the shoulder is the glenohumeral ligaments and the coracohumeral ligaments.
The glenohumeral ligaments, the joint capsule is found by this group of ligaments connecting the humerus to the glenoid fossa. They are the main source of stability for the shoulder, holding it in place and preventing it from dislocating anteriorly.
The coracohumeral ligaments, they are the main source of stability for the shoulder, holding it in place and preventing it from dislocating anteriorly. They act to stabilize the anterior aspects of the joint. Coracohumeral ligaments attaches the base of the coracoid process to the greater tubercle of the humerus.
And in this picture, you can see all the different coracoacromial ligaments and what they connect everything to.
And this is the end of our presentation.